good to see you. All right. I get asked this question a lot. Female ejaculation. And I'm going to give you some of my experience in this discussion because I think it's crucial. I think it's very important for you to hear some of my experience in terms of my patients and my studies, of course, that I've reviewed. And I really want you to know that this is real, okay? The female ejaculate, no question about it. But we have three types. I'm going to say from the get-go, the three types. Number one, which I know you've all suspected, urine. Yes, that is part of the female ejaculation. Two, squirting, okay, or gushing. That's a second type of female ejaculation. And number three, I'm going to label it female ejaculation. It's the true, concentrated, most common female ejaculation. Okay, so I'm going to say there are three types. Why? Because that's what I reviewed and that's what studies have observed also. So let's get into it. Okay, what is the female ejaculation? All right, so first of all, it is not vaginal lubrication. So don't get it confused. I've talked about vaginal lubrication before. Vaginal lubrication is where blood flow, remember, goes to the vagina with stimulation, erogenous zones, the vagina gets a lot of blood flow, and the transudate, the fluid goes into the vagina and makes you wet coming out of the vagina, okay? So that is vaginal lubrication. Today we're talking about the female ejaculation, which is fluid, liquid, released from the urethra during sex. Fluid, liquid, released from the urethra during sex. But 2 or 3 criteria have got to be met. Number one, it has to be involuntary. You are not controlling it. It's out of your control. It's happening on its own. Number two, it happens before orgasm or during orgasm. Okay? And number three, usually the anterior vaginal wall is manipulated, is touched, is stimulated. Okay? That's usually where you get the female ejaculation. Now, do you always have to have that inner vaginal wall touched? Usually, yes. I'm sure there are some cases where they don't, but usually, yes. And I'll tell you why it has to be touched. Okay? Because remember, it's involuntary. So what happens is that the female, in this case, I've got, again, another figure I drew for you guys. She's lying down. This is the vagina. And this is where her anterior or her belly button is. And this is posterior, okay? So we have the bladder here, the vagina, we have the clitoris here, and the paraurethral glands and the skin glands, et al., which means other glands and other structures right there, okay? So just picture it. This is the vagina, where you're going in this way, and about 4 to 5 centimeters anteriorly, you're going to see this complex right here. All right, you're going to see the structure. And this is the clitoris. Remember the clitoris, guys? Remember the clitoris? Okay, this clitoris is now on my diagram actually exactly how it lies in our body. Okay, this is exactly how it is. So for those that don't know the clitoris, please go research and look it up. This is our clitoris now, no longer a small little button. This is our clitoris. Please remember this and spread the news, spread the word, okay? So this is our clitoris, right? The bulbs, the legs, the glans clitoris, and some people call this the body or the shaft, but these are the major parts of the clitoris that you must know why. It's involved in your orgasm, okay? So I've drawn it in a bigger schematic picture here, and see how it envelopes the vagina. See how it surrounds the vagina. So very important for you to know the clitoris has got to be stimulated also, right? Now, how is it stimulated? It's stimulated by going into the vagina and up about 4 to 5 centimeters, and you get that digital pressure. It could be a light pressure, or it could be a vigorous, very strong pressure. You can use it with your finger or a toy, all right? But I'm going to just say right now, finger, okay? So digital pressure, digital stimulation, and remember, there is a difference between the stimulation, gentle stimulation of this area and heavy pressure, extra stimulation. Vigorous is the word. So there are two, light and vigorous. Light stimulation might not get you to ejaculate, right? The light stimulation might not make the fluid come out from this structure. And what structure are we talking about? We're talking about the clitoro-urethral vaginal complex. The clitoro-urethral vaginal complex. This structure sits right there, 4 to 5 centimeters into the vagina, anteriorly. Okay? And when you put pressure there, fluid, liquid will come out. There is an expulsion of fluid from the urethra. So we have the bladder, which is the urethra, and we have some little glands there. You know, we can call them skein ducts and glands. They're all coming here, right here, and they come out of the urethra, and that's where the fluid comes out. There are actually videos and diagrams of this, okay? So if you want to get that picture, let me know. I'll send it to you. So again, this complex, the clitoro-urethral vaginal complex, when you apply pressure, some people extra pressure, which some people, I guess, like, right? Again, to each their own. But when you put gentle, it can do it. When you put extra pressure, it can do it. The point is that there is pressure to this area and the fluid is expelled through the urethra and the duct here and the opening to the outside of the vulva, separate from vaginal lubrication. How much comes out? About, some people say 3 to 5 ml. Some people say 1 to 5 ml for female ejaculation. Okay, so we're talking about female ejaculation right now. The one that has the pure definition of the female ejaculation, not the squirting and not the urine. We're talking about the female ejaculation, okay? It is milky, the fluid. It is opalescent, like a little shimmery, little shiny, little see-through, especially when the light gets it. And it is sweet to taste. All right? That is the description of the female ejaculate. About 5 ml, milky, opalescent, and sweet to taste. Okay? That is what we are describing as the female ejaculate. And this female ejaculate has been studied over and over and over again. One of the studies that I love was by Diego. He had a case study, just one woman that had urinary stress incontinence. I'm sure you know what that is. That is when the detrusor muscle of the bladder, one of the muscles of the bladder is weak and you just let go of urine when you cough, all right? And she was using the Kegel exercises to actually repair and reverse the incontinence, which we know about, right? The Kegel exercises, we should all be doing it every second of every day, all the time, okay? That's what I recommend. But she was doing it to reverse her stress incontinence, urinary stress incontinence. And she successfully did that. And she found out about the female ejaculate, possibility. And she was curious and decided with her partner to try and see whether she could do it. She and her husband were able, with practice, to produce the female ejaculate, which she had not had before, by stimulating, putting pressure on the anterior vaginal wall, which is, of course, our G spot, right? You realize that? This is our G spot. All right. Now, could it be more than the G spot? Absolutely. Could it be like further up here, further down here? Absolutely. So the G spot, I think, is more, this is my personal opinion right now, for the orgasm. For the ejaculation, you've got to go deeper, harder into the complex, the clitoro-urethro-vaginal complex during sex while you're aroused, while you are being stimulated. So that erogenous zone, right, the G spot, you want to attack it a little bit more and maybe a little bit higher and a little bit lower to get what involved? The urethra. And I think when you do, for those that have the ability to ejaculate through these ducts, will do so and involve the bladder or the urine. Okay. Now, that was what she was able to do because they studied the fluid and found that it actually had a little bit of urine, but also had the female ejaculate properties, which I'm going to talk to you in a few minutes. You know, she did allow Dr. Adiego to observe, and Whipple and Perry, these are all great researchers on the orgasm and on the G-spot and on the female ejaculation. And they were able to see this with their own, 2 eyes. So it is real. She was not someone that had it. And then next thing you know, with practice, Kegel exercises, her partner, she was able to put pressure and accomplish having the female ejaculate. And I've heard this story from so many patients. Their partner did assist them in becoming what they call squirters, but I'm going to call right now the female ejaculate. Okay? Now, there was also another study done where 1,172 professional women were studied, and 40% of them had female ejaculation. 82% of them said that the G-spot was involved. Okay? 82% said the G-spot was stimulated and pressure was put, and that they actually had the fluid come out, which is the expulsion of fluid, which is the female ejaculate, during their orgasm, before and during their orgasm. Okay? That means some of them did not have the G-spot involved, or were not aware that the G-spot was involved, or there wasn't a lot of pressure put on it, right? And they still had their female ejaculate, probably less than others that probably put more pressure, right? Got that? And, what was interesting is that he also did a study. Part of the study was that he wanted to know whether if you just stimulate the clitoro-urethro-vaginal complex, meaning you just stimulate the G-spot, what would you get? And the answer was, it was great. They enjoyed it. It was 96% of them said erotic, loved it. 85% of them said highly erotic. Okay, so this definitely plays a role in the orgasm, getting them ready. And then if you go a little bit more deeper, put more pressure, the female ejaculate does come into play. Okay. Another study said if you just stimulate the clitoris, there's no stimulation of the anterior vaginal wall, the G-spot. Do you think you're going to have a female ejaculate? You're going to have any fluid come out? And the answer is not one. 38 women they studied, and not one of them, by just stimulating the clitoris alone, not one of them had any female ejaculate production. Isn't that interesting? So take note. You've got to stimulate all of the clitoris. And how does this rest of the clitoris get stimulated? Remember down here, right? You want to progress from the head or the glands down to the whole bulbs and the legs. This is the structure that needs to be not only stimulated, but swollen, engorged, involved in your orgasm. Okay. Now, I wanted to tell you about the composition of the three types of female ejaculate. All right. So I said there's urine, there is squirting, right, or gushing. Let's just say squirting for now, and the female ejaculate, which I just talked about. Okay. The chemical composition, there is more urea. I'm going to make it simple. There's more urea and creatinine in the urine. So that makes it more likely to be urine. So when these studies were done, when they saw mostly urea and creatinine, they knew it was urine. Okay. When they saw someone that had on this side the female ejaculate, they had a special protein called prostatic acidic phosphatase. Let's call it PAP, PAP, prostatic acidic phosphatase. All right, that is seen in the male prostate or the male ejaculate. Okay, so we're saying that this actual area here, the paraurethral gland, is the equivalent of the male prostate, which means that we have something like that too, which makes it more of an ejaculatory process. If we have the same protein that the men have in their semen and in their ejaculate, and we have it too, that means we also are ejaculating. So the true female ejaculate has PAP, prostatic acidic phosphatase, and it comes from the paraurethral gland. Okay. Also, they found some fructose. So fructose is also seen in this fluid that comes out, the female ejaculate. So we're going to see the PAP, we're going to see the fructose, and we're also going to see a little bit of urea and a little bit of creatinine from, again, the urethra, from the bladder, but not much, right? Most of it is coming from the paraurethral gland and some urea and some creatinine. That's what they found in studies, okay? In the squirting or in the gushing, another study was done by Darling, and he found that a lot of women that squirted or gushed were able to produce about 15 to 110 mLs of fluid. That's a lot of fluid. That's almost 4 ounces. And that's a lot of fluid. And he says the composition was urine, completely urine. No PAP, prostatic acidic phosphatase, no fructose. So what does that mean? He said these women did not do this voluntarily, which means they met the criteria of being involuntary. So they proved that yes, you can actually produce urine and it is still considered the female ejaculate because it's happening during your orgasm or before your orgasm, during stimulation of the G-spot. Let's just call it the G-spot for now, right? Putting pressure. And yes, some women will get urine that will come out, but remember, it's coming out without them forcing it out. So he says urine still is the female ejaculate. And another point he made was most people that are voluntarily doing it have a weak detrusor muscle, which is the muscle of the bladder, and they can easily do that by manipulating their bladder and their urethra, right, when they stimulate it. So it's voluntarily done. So people that walk around and say, I'll show you how to do it, and they're not having an orgasm, that is voluntary. That does not meet the criteria of the female ejaculate. This has to be during sex. And I did have a patient once. She did it during sex, pure urine. And she did not have a weak detrusor muscle. And I have had patients that have had weak detrusor muscles and also do it. So the ones that don't have the weak detrusor muscle and are doing it involuntarily, it is still considered ejaculate. But who knows and who really cares? As long as you are having a nice time in the bedroom with your partner, two consenting adults, and you're aware that you're not having any pain, or that it's not, excessive amounts of fluid being produced, then definitely I would want you to get checked by your primary care doctor, who will refer you to a urologist or a GYN urologist. The most important thing to note, though, is if you're not in pain and you're having a great time, you should be okay. All right, but you want to always get checked out. All right, so that's the most information I wanted to give you about the female ejaculate. 2 more points. Number 1, the stronger your pubococcygeal muscle, right, that muscle down there in the pelvic floor, the stronger and the more of the female ejaculate. Same thing with the uterus. The stronger your uterine muscles, they studied it and they found out the more the female ejaculate. So those are other 2 factors, which means if you exercise and do your Kegel exercises, and regular exercises, but pelvic floor exercises, strengthening, right, you will find that you might have a much better female ejaculation than you've ever had before. All right, guys. Hope you enjoyed that. I'll see you tomorrow. Take care. Have a great night. Bye.